All right, today we're jumping right into the operating room, metaphorically speaking, to tackle a really interesting question in shoulder surgery. We're going to look at a case where the common sense idea of doing more to fix a problem might actually be doing more harm. It seems totally logical, right? If you're already doing a big repair, why not reinforce it a bit more? It should make things stronger, better. But here's the thing about medicine. What seems logical doesn't always hold up to the evidence. So let's see what the data actually says. Okay, so first things first, we need to get a handle on the condition that brings people to this surgery in the first place. It's a pretty serious one called rotator cuff arthropathy. So picture this, the small group of tendons that lets you lift and twist your arm, that's your rotator cuff. Gets torn so badly it just can't be fixed. Well, over time, that injury leads to this painful, grinding arthritis that basically just destroys the shoulder joint. And that's RCA. For the people going through this, it's not some abstract medical term. It is a daily, constant struggle. We're talking about chronic pain, really profound weakness, the kind that makes it impossible to do simple things, like combing your hair or grabbing a mug from the top shelf. It's a huge hit to your quality of life. So what do? How on earth do you fix a shoulder when the main tendons are just gone? Well, surgeons came up with this brilliant and totally counterintuitive solution. And that's really the genius of it. Instead of trying to patch up something that's broken beyond repair, they found a way to completely redesign the shoulder's mechanics, to just bypass the problem entirely. Okay, so in a normal shoulder, you've got a ball on your arm bone fitting into a socket on your shoulder blade. In this reverse surgery, they literally flip it. The ball gets attached to the shoulder blade, and the socket goes on the arm bone. Now, that might sound like a small change, but it makes an enormous difference. It lets the big, powerful deltoid muscle on the outside of your shoulder take over the job of lifting your arm. It's just an incredible piece of bioengineering. And this brings us right to the heart of the matter. This reverse surgery is amazing. It works really well. But surgeons, always trying to improve, started asking, could we make it even better? And the thinking behind it made a lot of sense. Hey, while we're in there, why not also repair some of the other tendons that are less damaged, like the subscapularis? Could this augmented version add more stability, improve function even more? It was a really important question that needed a solid answer. So, to finally put this debate to rest, researchers grabbed the most powerful tool in their evidence-based toolkit, a systematic review. They went out and meticulously gathered every single high-quality study on this topic to get a clear, unbiased picture of what was going on. And listen, this was no small undertaking. They pooled all the data from 15 different studies, looking at the outcomes from more than 1,400 patients. That's a huge sample size, giving them the statistical power they needed to draw some really solid conclusions. Okay, this is where it gets really interesting. The data's all in. It's time to put these two surgical approaches head to head and see which one comes out on top. So, in one corner, we have the standard procedure, the reverse total shoulder arthroplasty, or RTSA. And in the other corner, we have the augmented version, the RTSA plus those extra tendon repairs. Let's see what the numbers have to say. First step, let's look at one of the biggest measures of success. How high can patients actually lift their arm afterwards? And right away, we get a surprise. The group with no extra repairs actually had slightly better elevation. No, it's a tiny difference for sure, but it definitely shows that all that extra work didn't help on this front. All right, well, what about overall shoulder function? We can measure that using something called a constant score. And again, look how close those numbers are. The repair group score is a little bit higher, but that difference just isn't big enough to be statistically significant. So the big takeaway here? The added complexity just didn't translate into any meaningful improvement for the patient. And this is the crucial moment in our story, because if the benefits are pretty much the same, then the whole decision really comes down to the risks. And as we're about to see, the risks are not the same. Not at all. Wow. Okay, this is where things take a really dramatic turn. The standard group did have a higher rate of one specific issue, scapular notching, which is where the implant can rub on the bone. But just look at the repair group. The rate of dislocation, over 3 times higher. The need for a second surgery to fix the first one, more than double. And then you get to that last. A staggering 80%. Let that sink in. In the group that got the extra tendon repairs, 4 out of every 5 patients had some degree of humeral osteolysis. That's a weakening and loss of the bone around the new implant. And in the standard surgery group, 0. Nothing. This isn't just a small difference. This is a massive bright red flag. Well, when you see data that's this clear, the conclusion is pretty much unavoidable. The Showdown had a very, very decisive winner. And there it is, the final word, straight from the researchers themselves. After sifting through all of that data, they concluded that the more complicated, augmented surgery just didn't offer any significant benefit, and certainly not enough to justify all those added risks. So here's the bottom line. That standard reverse shoulder replacement, that incredible feat of bioengineering we talked about earlier, it is a fantastic solution all by itself. It gets people out of pain, it restores their function, and, as the evidence clearly shows, it does it more safely than the more complicated version. And that kind of leaves us with a really fascinating thought, doesn't it? This whole story was about how a very logical idea, that more is better, was proven completely wrong when it was finally put to the test. It really makes you wonder what other common practices, in medicine or anywhere else, might look completely different if we just took a step back and followed the data.